Burning, numbness, tingling. If you're feeling this kind of pain throughout your body, it is time to get help. But if you don't have the right diagnosis, the pain may never go away. Dr. Todd Levine, a neuromuscular neurologist at Phoenix Neurology Associates, is here to explain how getting a correct diagnosis for fibromyalgia is so important. Great to see you.
Thank you.
For those who don't know, what is fibromyalgia and what causes it?
So it's a very complex disorder, but the main feature is chronic widespread pain. So patients have pain throughout their entire body, above and below the waist, the right and the left side. And for most of the time that we've known about this disorder, we really haven't had any specific tests.
How is it diagnosed then?
It's really diagnosed clinically. So up until the last couple of years, patients would complain of this pain. Their neurologic exam and physical exam would be relatively normal, except for the presence of tender points, which are certain areas on the body that the doctor would push on and would be exquisitely painful.
So where does the pain come from?
Well, the thought had been that the pain really came from the brain, that the brain was not processing the signals correctly. But over the last 2 years, what we've discovered is that about 50 to 60% of patients with fibromyalgia actually have damage to the small little nerves in the surface of their skin.
I would have to imagine for a patient knowing what kind of nerve damage a patient has would be vital to fixing it.
Well, it's very important, number one, for the patient, because it does give objective evidence that there's something that's causing the pain. And many patients, unfortunately, will go years with fibromyalgia pain and really be told that there's nothing wrong with them. So number one, this gives us a sense of being able to say, yes, this is something specifically wrong. The second, and really the most important part for me as a neurologist, is that it tells us that the nerves are damaged. And once we know that the nerves are damaged, we can then start to look for specific causes which might be treatable.
So is there a test?
Yeah, so the test is actually relatively simple, and these small nerves, the nerves that cause the pain in fibromyalgia, actually are in the surface of the skin. And so what we do is a little skin biopsy, just like a dermatologist would do, no stitches, and then it's processed in a very special lab to be able to count the number of these small pain nerves that are in the skin.
I would have to imagine folks who get this test done would have to know, one, that they have fibromyalgia, right? Or at least to feel like they do, to ask their doctor, hey, can I get this test done?
Well, yes and no. So number one, they might come in and say, I have fibromyalgia. Number two, they might come to their doctor and just say, I've been having this burning pain, this tingling, this cramping. All of those kinds of symptoms are symptoms that those nerves are sick.
Okay, is this test, is it painful?
It's not painful. It involves a little lidocaine injection, and so that burns for about 10 seconds, and then after that they're numb. There's no stitches, and it just heals up basically normally, or maybe just with a teeny little scar.
For people who have been misdiagnosed, nobody can get to the bottom of it. They're given pill after pill after pill. This test must be so rewarding for them to finally be able to figure this out.
Yeah, for the patients that I've been able to do this on, and for doctors around the country that do this technique, it really gives us a more clear evidence of what's wrong with the patient. And then hopefully we get a diagnosis that we can treat, but it also allows us to pick better pain medicines. So if we know that the pain is coming from a nerve, that is one set of medicines, whereas if the pain is coming from the muscle, that may be another set of medicines.
Is the test expensive, and does insurance cover it?
Yeah, all insurances, so Medicare covers it, private insurances cover it. It can't be done in a regular lab, so the technique is very difficult. So I have one of the labs that does it across the country, and patients can get it done anywhere, and then it's sent into our lab, and it takes about a week or 10 days to process. And then we get a very beautiful picture of their nerves and their skin, and we can tell them if they're healthy or sick.
All right, so there you go. If you want to start getting on the road to recovery, to learn where you can get one of these Corinthian reference lab tests done, you can give them a call at 888-330-5103. You can also visit them online at CorinthianReferenceLab.com.